Today, we're at Healthy North Coast, one of the most beautiful parts of the country where the sun is shining, a fabulous place if you ever get to come here, and some of the most fabulous people we've ever worked with. We've been working with Healthy North Coast and Northern Coast communities here in New South Wales over the last decade, but now we're getting down to what we really want to do, developing a youth services model for implementation to change the way that we try to improve services for the young people who live here. We have people from the primary health network, we have people from the local health districts, we have people from the non-government organisations. Most importantly, we have a large group of young people who are telling us what really needs to be done. They can see what they want, they can see the chaos that surrounds them. They want us to do things differently. They want us to coordinate care to make a difference. They want us to come up with the tools to help with advocacy, the tools that help with making smart services decisions. So stop throwing things in that don't help, but actually work with the community to come up with a system now and for the future that will make a real difference.
So my hope for this program is to be able to understand where we need to meet the needs better, where there are gaps and any solutions that we can do to help fill those gaps. What I really also hope is that the voice of young people are going to be really elevated and shared, and a key element of what we do and how we shape mental health programs and services and funding in the future. And another thing that I really want to see is better collaboration between all health services, education, justice, all of the services that support young people to work better together and make better service investment decisions.
Well, right from the introduction of the day where they advised us that 30 young people were attending, I felt really hopeful about hearing the voice of young people and what they see as the needs in the community. That's become really important in service planning, and part of my role is really to think about the future, to identify where gaps in services are, and to think about what we've got right here and now and what's not working.
What I'm hearing is that by capturing the experiences of young people and hearing their voices, the model can really represent them, and we can have different scenarios, different services, different economic outcomes that are based on the lived experience of our young people. And I think just inviting them to be at the table to set the foundation of a model is what's necessary. And it's so exciting that it's happening and that we're here to do it.
Because it gives us such a good platform to build on. So from here, I'm really excited about being able to start stratifying some of that information, to start looking a bit deeper. So usually we would look at reach, access, all the usual things. Here it's really interesting. Something I heard in the group was that it's compatibility rather than access, which is an issue from the perspective of people here. So that's a great area for us to start to dig into. I think it's very outcomes focused once we get into it, so that will start to actually enable some innovation and looking at what the different regions need rather than an incremental more beds. So that's really exciting.
And my hope is to just really improve that kind of support that people need, especially within their selective communities. Obviously on a massive national scale, a lot of people need support, but the whole sense of community is really important for the progressive support of mental health and that development and keeping people safe and secure, and stuff like youth hubs, something like that. I think more of that is my hope for the outcome of this workshop.
My hope for this entire program is to design a model where we're listening. We haven't listened well, and we've decided what's right for young people, and we've decided what's right for our region, and it's not right and it's not working, and we're not actually accessing the populations we need to. We need to do it differently, not short term, we need to do it differently. We need to do longer interventions, go to where people are at, go out into the community, and don't make assumptions about what's right for populations and people. And we need to access populations that can't get to health services or can't access services.